Hello, Amy, and welcome to what should have been a Tuesday Night Live and is now officially a Tuesday night pre-record. So I'm sorry we couldn't get you on the live call tonight, but it's really powerful that we bring tonight's recording out to our listeners, because mushrooms are such a powerful part of our modalities here at Embracing Nutrition. And I've been certainly working with Hifas's mushrooms for probably in excess of 10 years. So with that in mind, this was a really, for me, a really important thing to bring to our listeners, because they're such a passionate part of my clinical practice. So do you mind just kicking off and just telling our listeners a little bit about Hifas? And I've been over to Spain, I've been to visit Hifas, but not many people get that opportunity.
Yeah, well, thank you so much for the wonderful introduction, and it's so lovely to be here with you. And thank you for the opportunity to speak about medicinal mushrooms this evening and about Hifas da Terra as a company. So Hifas were founded in 1998, and they were founded by biologists who met at university. Catalina, our CEO, her father was a mycologist, and they actually started looking into medicinal mushrooms to help family members who weren't very well at the time. So they've since then become Europe's largest medicinal mushroom biotech company, and they've really branched out, and we've invested 62% of our profits year on year into clinical research and development. So that's to prove not just the quality of the medicinal mushrooms, but also to prove that they are safe and that they are effective. So that's the difference with Hifas da Terra. We have this huge focus on our scientific evidence, on our quality, and the medicinal mushrooms are really the highest quality that you can get. So we use only organic medicinal mushrooms. We do grow them ourselves, but as we've grown throughout the years, we now use trusted organic growers in Spain or in Europe, so we know exactly where the mushrooms come from. And we actually use an external lab to do a triple analytical safety check on these mushrooms to check for any kind of molds, pesticides, even things like gluten or heavy metals. So what you're getting is actually a very pure organic medicinal mushroom. And the other great thing about them is that we just use the fruiting body. So a lot of companies will use what's called the mushroom biomass. So if you're familiar with growing mushrooms, you'll know that you have to inoculate the growth mediums, such as, we use wood, so we grow our mushrooms on wood, but some companies will use grain, such as brown rice, for example. And once that has myceliated, eventually the fruiting body, which is the mushroom itself, will grow from that grain. And that's obviously the part that we should be using. But a lot of companies will cut corners. So instead of waiting for that fruiting body to grow, what they'll do is just use the whole kind of substrate. So they'll put in there the mushroom biomass, and what you're getting is then quite a starchy product, which has diluted the mushroom content. And if somebody has SIBO, it might not be potentially the best thing for them to have a lot of, starchy rice in there. So what you're getting with Hifas da Terra is just the fruiting body, and that's the same for all of our mushrooms. The only exception would be cordyceps. So when I talk about cordyceps sinensis, we actually use the mycelium in that case, but we grow it from algae, so it is grain-free. And the reason that we can use the mycelium is that in the wild, cordyceps sinensis will grow from insects, whereas we grow it from algae to keep it vegan. It's just a bit harder to actually grow the fruiting body, but we can grow the mycelium very well.
Amazing. So from a therapeutic point of view, this is why any of our listeners who've used mushrooms with us will always know why we go for the creme de la creme. And that might be reflected a little bit from a price point of view, but then instead of taking 6 of this product, you only need 2 of this product. So actually, pence per dose, there probably isn't much in it, but pence per therapeutic dose, there's definitely nothing in it, is there? From a, you're getting the best quality and quantity in your dosage.
Yeah, absolutely. So Hifas use a green extraction process, which is under industry secrecy, but they've found a way of actually condensing the most amount of the bioactive compounds in the mushrooms, so that what you're getting is actually a therapeutic dose with the extracts. And they also know that this is a green extraction process, so it's good for the environment. We're very environmentally conscious. So that's another reason, you know, obviously we do care about the environment. We use glass packaging. We have sustainable mushrooms as well. And we also plant 120,000 chestnut trees each year to try and rejuvenate the local forests in Galicia, where the head office is. So,
and I've walked around said trees with my own feet to prove that they were being planted. So tonight we're going to talk more about the benefits of medicinal mushrooms for gut health. Now, me and you could go live every Tuesday for the next month and bring out different topics. So it is quite important to make sure we actually get some good education out of our Tuesday night live. So rather than just talk about mushrooms in general, we wanted to talk about mushrooms and gut health. Yeah. Now, gut health, truthfully, is something that not many listeners would close tonight down and say, that's not about me. Because so many individuals, whether your diagnosis is an autoimmune disease, whether your diagnosis is autistic spectrum disorder, or it's cancer, or it's Alzheimer's disease, not many individuals you couldn't say gut health should come first. And then, of course, there is the clients with this umbrella term diagnosis of IBS, which, if anybody's heard me talk about IBS before, that is one of my most hated diagnoses. Not because I don't believe the symptoms, because I believe it should be reclassified as a functional bowel disorder, which requires functional practitioners to dig down deep and find the cause, whether it's SIBO that you mentioned, small intestinal bacterial overgrowth, whether it's bacterial imbalance in the large intestine, whether it's parasites, whether it's candida, whether it's gastritis. It's like we need to name the specifics. Yeah. So if we think about gut, and our poor gut microbiome gets a battering in today's world, doesn't it? It's sort of the interface of the outside and the inside. It like comes into contact with everything. Yeah. So with that in mind, most of our clients don't have the best gut microbiome. So how can medicinal mushrooms, because most people think about, if I blindly asked 20 of our clients, they would generally say mushrooms are for immunity. Yeah, you and I know that they go way beyond immunity, but that, I think, is most people's preconception, because maybe that's what they've read, that's what they've seen on social media, even read in research papers. So it's not wrong, but today I want to get out the message that mushrooms are so much more multifaceted than just being for immunity. Absolutely. How can medicinal mushrooms help gut health?
Yeah, well, medicinal mushrooms are actually full of lots of different active biomolecules. So if we're talking about immunity, they contain beta-D-glucans and triterpenes, which are very good at helping to support the immune system to function appropriately. And so they're known as immune modulators. But actually, the mushrooms are full of polysaccharide fibers, which act as prebiotics for the gut. So this actually includes the beta-D-glucans, but also alpha-glucans, chitins, xylins, leptins, and these act as a food source for the beneficial microbes in the gut, otherwise known as the resident probiotic strains. And there's actually evidence that we can manipulate our microbial community in as little as 4 days with changes in the diet, which is pretty fascinating. So medicinal mushrooms are actually one of the ultimate prebiotics. And that's because, unlike some other prebiotic fibers, they possess antibacterial and also antifungal properties. So this means that they can help to prevent the growth of pathogenic microbes and fungi. And some of the best antibacterial mushrooms include shiitake mushroom, oyster mushroom, reishi, lion's mane, and these are all contained in a blend that Hifas have created called Hifas Microbiota, but it's also contained in biointestine. So these are some of the best mushrooms for their prebiotic fiber content. But actually, when mushrooms are consumed, these compounds can help to prevent the growth and the spread of harmful bacteria in the gut. And this actually reduces the risk of infections and the development of antibiotic resistance, as some studies have quoted. So actually medicinal mushrooms can be really helpful if someone's suffering with dysbiosis. As you've mentioned before, this is an imbalance of those microbes in the gut or a reduced diversity, which can lead to the pathogenic overgrowth. And then dysbiosis may also present itself not just as IBS, it might just be things like bloating, excess wind, diarrhea, constipation, or gastric pain and inflammation. And dysbiosis is actually commonly seen in food poisoning and gastritis caused by infection, often in SIBO, for example, IBD, IBS. But actually, a really interesting study found that dysbiosis has been linked to 105 diseases, and this includes both gut-related diseases, but also non-gut related conditions, which I think is really interesting.
Yeah, definitely. So that's what I mean. Most people that present with anything, I always used to say when I was lecturing at an undergraduate level, you'll never get it wrong if you start with the guts.
Yeah.
And been in clinical practice for 15 odd years now, and I'm yet to have a client that hasn't got some form of imbalance in their gut microbiome, even though that might not be why they've come to me.
Yeah,
so
absolutely.
Lots of those things that you mentioned, Amy, fall under this umbrella term. Joe wants to classify it functional bowel disorders. It's currently classified as IBS. But what about IBD? Can mushrooms be used in patients who've got the more inflammatory element of gut imbalance, with a diagnosis maybe of Crohn's, ulcerative colitis?
Yeah, absolutely. And it's very safe to use medicinal mushrooms in this case. Studies actually indicate that lion's mane extract and powder may be clinically useful for inflammatory bowel disease, so IBD, and that includes Crohn's disease and ulcerative colitis. And some studies say that it can be useful for irritable bowel syndrome as well, IBS. And that's because it works to help to promote the beneficial changes in the gut microbiota, as well as regulating the immune system. So lion's mane can help to repair leaky gut by regenerating the gut barrier and preventing its degradation and the formation of ulcers and scar tissue, thus helping to resolve intestinal permeability. So lion's mane is actually very good at helping to increase key probiotic species, which help to maintain the mucosal barrier, such as Akkermansia mucophilia. So that is really, really important to keep that mucosal lining nice and healthy, and then that helps to protect the epithelial barrier. So lion's mane can also support the gut-brain axis, and this is a real issue in conditions such as IBD and IBS. A study found that supplementation can improve depressive symptoms and anxiety in just 4 weeks, which is pretty amazing. Some studies have shown that lion's mane can help to improve abdominal pain, and also that it can decrease the MPO enzyme, and high amounts of this enzyme can correlate with inflammatory bowel diseases. And lion's mane also has additional anti-inflammatory and antioxidant effects, as well as gastroprotective effects. And we quite often recommend to use lion's mane in conjunction with reishi, because reishi has this very powerful anti-inflammatory effect. So medicinal mushrooms, as I mentioned before, contain beta-D-glucans, which help to modulate the immune system. But in the case of over-inflammatory responses, the beta-glucans and the triterpenes in the mushrooms can actually help to down-regulate the inflammatory cytokines. And these cytokines are basically communication signals for the immune system. So reishi actually has one of the most potent anti-inflammatory effects. So it's triterpenes, namely the ganideric acids, but also the beta-D-glucans, affect the pathways leading to inflammation and pain. So reishi has been shown to moderate pro-inflammatory cytokine secretion. For example, it suppresses the secretion of the inflammatory cytokine, TNF-alpha, but also interleukin-6, and it can also help to reduce nuclear factor kappa B. So these are key factors in chronic inflammation. But reishi has also been shown to regulate prostaglandins and other inflammatory medias such as nitric oxide. So if we're looking at conditions like inflammatory bowel disease, TNF alpha is actually a crucial component in the pathogenesis of it. So they've now obviously developed TNF alpha inhibitors, which can be applied in the clinical treatment of autoimmune diseases such as Crohn's disease and rheumatoid arthritis as well. So actually having something natural which doesn't have the side effects that immunosuppressant medications might, which naturally helps the immune system to adapt as needed, I think is absolutely fantastic.
Amazing. And obviously, I asked you the question regarding IBD. You also mentioned rheumatoid arthritis, but realistically, we can apply what you've just said, whether it to be to psoriasis, to multiple sclerosis, to all autoimmune diseases. And autoimmune diseases are like classed as the 4th biggest killers in the Western world in under 60-year-olds. And the amount of individuals from young children to elderly being diagnosed with autoimmunity on an annual basis is colossal. So it is so beneficial to have something in our kit bag to help as a potential, let's get on you this, so you might not need that, but we can also use them adjuvant to more therapeutic drugs like TNF alpha inhibitors, can't we? Like the individuals that are on those Humira, infliximab, tocilizumab, like all of those drugs, which if you're that individual, and this is my passion, this is what got me into functional medicine, because this is where my daughter's journey came in. But it's so powerful to have something else that can help from an immune modulation point of view. And whilst we can't tell people to come off drugs, we're not asking anybody to come off drugs. Actually, the way I describe it in clinic is you're currently walking on a balance beam and you've got or on a thin tightrope, you've got no balance beam, you've got no safety net. And actually what mushrooms do is it gives you a safety net, it gives you a balance beam. So even if all we achieve is disease stability on the drug, but actually I've had many a client go back to their gastroenterologist and say, look, I'm 2 years asymptomatic, can we trial me off drugs? I've got one youngster that came to me, his early 20s now, with horrendous Crohn's disease, calprotectin in excess of 1,000, had been on Humira, but still had regular bleeding, colon, explosions, daily basis, fissures that wouldn't heal, completely off drugs, having used medicinal mushrooms for a period of about 18 months before he then went to his gastroenterologist. His gastroenterologist was completely in favor of giving him a break. He's now been off drugs for probably another 18 months. How amazing is that?
That's absolutely fantastic. I know personally, this is the reason why I got into nutrition as well. So it's so interesting that you say that, because I was studying psychology and I kind of went back to university and studied nutrition, because unfortunately I got diagnosed with ulcerative colitis when I was around about 20 years old. And, it's been a bit of a journey working out in terms of what works for me and my diet, and actually discovering how powerful manipulating the microbiome can be to help with controlling it, and to actually coming off any kind of medications that I was almost sort of forced to be on, have been really, really helpful. And, I'm in complete remission and I haven't had issues. In fact, I haven't even spoken to an IBD nurse for about 2 years. I thought they'd completely discharged me. So yeah, it's pretty amazing what you can do when you use diet and nutrition and supplements such as medicinal mushrooms and probiotics to manipulate the gut microbiota.
Obviously, we did just talk about pain with regard to maybe autoimmune associated pain, but can we apply that to just pain? Because there's lots of people out there, whether their diagnosis is regional pain disorders, whether it's fibromyalgia, so non-autoimmune pain disorders, some form of chronic pain. Can we apply mycotherapy to that?
Yeah, absolutely. Well, recently Hifas da Terra performed a study with patients who suffered with restless leg syndrome. So this is a really common sleep-related sensorimotor disorder, which is characterized by discomfort in the limbs when trying to sleep. And the pain's described as a prickly or a stinging or a burning sensation. And sometimes the discomfort is so unbearable and people have to move or massage their limbs to actually gain some relief. So after 18 patients with idiopathic restless leg syndrome took 2 capsules a day of myco-ray, which is Hifas da Terra's concentrated pure organic reishi extract for 2 months, 72% of them reported relief from the painful condition. So it's not just restless leg syndrome. I mean, obviously, this is a recent study where they found that relief with pain, but reishi extract has also been reported in double-blind RCTs to reduce pain in rheumatoid arthritis patients compared to a placebo. And it's often said to have analgesic effects for patients with active rheumatoid arthritis. Plus, it's commonly reported that reishi extract is generally safe and well tolerated. And then if we're looking at other studies, for example, another double-blind RCT using reishi in fibromyalgia patients found that after 6 weeks of the reishi treatment, it reduced the impact of fibromyalgia and reduced the pain levels by 20 to 30% in the fibromyalgia patients, whilst increasing the health-related quality of life. So, for example, some people experience issues with sleep, and obviously movement is an issue. So it helps to improve sleep and movement.
Amazing. And they're actually some of those that you've just mentioned there, restless leg syndrome, fibromyalgia, they're conditions that very much fall under the radar as intervention suitable. Like the NHS have very, very little bar using pain meds, more pain meds, nerve blocking pain meds like amitriptyline, like they have nothing to help those individuals. So to have something powerful to make a difference, even 30% difference is like, I think those patients would take a 30% improvement in their symptoms, let alone 70% improvement in their symptoms. And when you then combine that 70% with changing diet and lifestyle, which of course here at Embracing Nutrition, we cover the whole amount, then 70% can soon become a much higher percentage. And that's what we're looking at, is making a difference. So is there anybody that can't take mushrooms? Anybody from a dietary point of view? Anybody from a medication? And obviously, I'm very conscious that we do need to drug nutrient interact. But is there any groups of individuals that you would say can't use mushrooms?
Generally, mushrooms are very safe, and as long as people can tolerate mushrooms in their everyday diet, it should be suitable for them to take medicinal mushrooms. With medicinal mushrooms, we do have one contraindication, and that's with strong blood thinning medications. And it's because reishi can have a blood thinning effect. So obviously we don't want to over thin the blood if somebody's on warfarin, for example. The other thing for that same reason is that we'd recommend stopping taking the concentrated reishi extract at least 4 days prior to having any kind of dental surgery or surgery, and only taking 4 days post-surgery. And we do actually have a fantastic study by a separate organization called the Medina Foundation, who investigated Hifas da Terra's concentrated extracts to see if there was any kind of drug interactions. So they looked at the main drug metabolism pathways of the liver, and they actually concluded that there's a non-significant, which was deemed a low risk of interaction with those main drug metabolism pathways, which is really reassuring to people that might be on other medications. Yeah, definitely. So it's not going to affect the breakdown of them. The only thing that we would say, just as a precaution and to maximize the absorption of the medicinal mushrooms, is to always take medicinal mushrooms on an empty stomach and away from any medications or other supplements if you don't want there to be any interaction by at least an hour.
Yeah, amazing. And generally, we always say to people, take them first thing in the morning, and then the job is done at that point.
Yeah.
And yes, I always say, I generally put warnings at the bottom of people's plans saying keep 2 hours away from medication. And then we know we've got that safety. But it's fantastic because so many clients are taking medications when they come to us because they're coming to us with a health condition that may require medication from their doctor. So that's so reassuring to know the minimal number of drug interactions, and where you know people are on drugs, there's a minimal risk by supplementing mushrooms with the pharmaceutical drugs that they remain on. And I mean, at Hifas da Terra, and again, that can be maybe another night's conversation. I mean, you've even got blends suitable from very young, haven't you? Of which my little girl goes to the fridge, knocks on the door, gets the bottle of medicine and goes, poorly, medicine. So my disclaimer on that one is it's quite addictive to the youngsters. My little girl thinks that she's got a cough every day and might need an extra dose of mushrooms. So you have got options outside of pills for individuals that can't take pills, haven't you?
Yeah, absolutely. We often get that feedback from children or parents of children, actually, that the children's syrups that we do, which are actually sweetened with a natural unrefined sugar called agave, which actually has lots of health benefits. They also have acerola cherry in there, which is a source of vitamin C, and it gives them almost like a berry flavour. So the Dr. GB and the Dr. Immune 5 are the two children's syrups that we do, which have mixtures of mushrooms. So Dr. GB has got reishi and lion's mane, that fantastic duo to support the gut-brain axis. And then Dr. Immune 5 has 5 of some of the best immune modulating mushrooms for children, which includes reishi and also Agaricus blazei morel, which actually helps with balancing the Th1 and Th2 part of the immune response. Often children who have asthma or autoimmunity or allergies have an imbalance of that Th1 and Th2 immune response. So I think they're really kind of unique, and particularly with going back to school in September, we want
always the bugs just escalate.
Exactly. So we really want to start supplementing children now to build up their immune system, to protect them against any kind of viral or bacterial infections that might be floating around, and also to help with their kind of emotional resilience as well. We know mushrooms are so fantastic to support, as I mentioned before, the gut-brain axis, but to really help with reducing levels of anxiety. So some of the mushrooms, reishi, have very calming triterpenes, which can help to reduce anxiety and stress levels and also improve sleep quality. So I think that's really important.
Amazing. I'll happily keep giving my little one them. It does help her when she's got infections, and I alternate between the two depending on what our goal is, or depending on which bottle of medicine she's pulled out of the fridge at that point. so it's lovely that sort of it's suitable for so many different, it's such a wide age group, such a wide group of individuals with different health conditions. But tonight, really thinking about the gut microbiome, and starting with the basics. Whether your diagnosis is an IBD, whether your symptoms mimic functional bowel disorder, or whether you've got a different diagnosis, incorporating medicinal mushrooms within our protocols is such a powerful tool. Thank you so much for your time this evening, Amy, and thank you to all of our listeners. And please do share whatever platform you've seen us on tonight. Please do share, because you might not be affected by something we've talked about, but your loved one, somebody you meet on the street, one of your social media connections might be desperate for the help that we can offer. And remember, the whole purpose of us coming live is all about education and is all about making a difference. So thank you so much for your time this evening, Amy, and I look forward to seeing you all again soon. Take care.
Thank you so much, Jo. Take care. Thank you.